What is the significance of a comprehensive assessment in addiction treatment, and how do techniques like interviewing, questionnaires, and observation contribute to this process? Answer: a comprehensive assessment is crucial in addiction treatment as it helps to gather detailed information about the patient's substance use history, mental health, medical conditions, and social factors that may influence their addiction. The assessment typically involves three key techniques. Interviewing allows the clinician to build rapport with the patient, gain insights into their personal history, and understand the psychological, emotional, and social factors related to their substance use. Questionnaires. Structured tools such as the CAG questionnaire, AUDIT, or DAST provide standardized questions that help identify substance use patterns and associated problems. They ensure that no critical areas of the assessment are missed. Observation. The clinician observes physical signs, behavior, and nonverbal cues that may indicate addiction or co-occurring disorders. For example, withdrawal symptoms, mood swings, or changes in behavior may offer important diagnostic clues. The DSM-5 diagnostic criteria guides the assessment process by providing standardized definitions for substance use disorders, enabling a systematic evaluation of severity and the formulation of a treatment plan. How does the DSM-5 diagnostic criteria for substance use disorders classify the severity of addiction, and why is this important for treatment planning? Answer: the DSM-5 diagnostic criteria classifies substance use disorders into three categories of severity: mild, moderate, and severe, based on the number of criteria met by the individual. The criteria assess the psychological, physical, and behavioral impact of substance use. Mild: 2-3 symptoms are present. The individual may experience some negative consequences from substance use, but it does not significantly impair their daily functioning. Moderate: 4-5 symptoms are met, suggesting that the addiction has more impact on the individual's life and functioning. Severe: 6 or more symptoms indicating significant impairment or distress, and the individual may be at risk for health complications, legal problems, or interpersonal conflicts. Understanding the severity is crucial for treatment planning because it helps the clinician determine the appropriate level of care. Outpatient versus inpatient treatment, the types of interventions required. Detoxification, therapy, medication, and the duration of treatment. It also aids in monitoring progress and adjusting the treatment plan as needed. What role does screening for co-occurring disorders play in the treatment of addiction, and how can ANS identify these disorders during the assessment process? Answer: screening for co-occurring disorders, also known as dual diagnosis, is essential because individuals with addiction often have underlying mental health conditions such as depression, anxiety, PTSD, or personality disorders. These co-occurring disorders can complicate the treatment of addiction, affecting outcomes if not identified and treated appropriately. During the assessment, a nurse should use screening tools like the Mental Health Screening Form, or ASI, Addiction Severity Index, to assess for the presence of psychological symptoms. Conduct a thorough mental health history interview, asking about previous diagnosis, treatment history, and any signs of psychological distress. Be aware of behavioral cues such as mood swings, paranoia, or isolation, which could indicate a mental health disorder. Treatment planning for individuals with co-occurring disorders often involves an integrated approach where both addiction and mental health issues are addressed simultaneously through dual diagnosis treatment programs. Mr. Thompson is a 34-year-old patient who presents with a long history of alcohol use. He has attempted to quit several times but relapsed each time. He is seeking treatment again, but expresses reluctance toward medications and prefers natural methods. After comprehensive assessment, the nurse identifies signs of alcohol use disorder, but also suspects he may have underlying generalized anxiety disorder, again based on his reported symptoms of excessive worry and restlessness. What steps should the nurse take in formulating Mr. Thompson's treatment plan, considering both his alcohol use disorder and potential co-occurring anxiety disorder? Answer: given Mr. Thompson's reluctance to medication and potential co-occurring generalized anxiety disorder, the nurse should take a multifaceted approach to treatment. Integrated treatment plan. Develop a dual diagnosis treatment plan that addresses both the alcohol use disorder and anxiety disorder. This approach should include both pharmacological and non-pharmacological interventions to improve his chances of success. Screening and diagnosis. Confirm the diagnosis of GAD using DSM-5 criteria and ensure that the treatment plan is based on his severity of AUD and GAD. Non-pharmacological interventions. As Mr. Thompson prefers non-medical methods, suggest cognitive behavioral therapy (CBT), which is effective for both addiction and anxiety disorders. Motivational interviewing could also help increase his readiness for change. Pharmacological considerations. While Mr. Thompson may be reluctant to medications, it may be necessary to introduce medications like SRI antidepressants, e.g., sertraline, to address his anxiety symptoms, as anxiety can exacerbate alcohol use. Disulfiram or acamprosate could be considered for alcohol dependence if he becomes open to pharmacological treatment. Collaboration with mental health providers. Involve a psychiatrist or mental health counselor who specializes in dual diagnosis to ensure that both conditions are treated concurrently, preventing relapse and improving overall treatment effectiveness. How does polysubstance abuse complicate the treatment of addiction, and what strategies can nurses use to effectively manage patients with this condition? Answer: polysubstance abuse refers to the use of more than one substance, such as combining alcohol, opioids, and stimulants either intentionally or unintentionally. This condition complicates treatment because each substance may have different withdrawal symptoms, risks, and treatment approaches. Moreover, the interactions between substances can amplify their harmful effects, complicating diagnosis and intervention. Assessment: a comprehensive assessment should include questions about all substances used, e.g., alcohol, opioids, stimulants, benzodiazepines, detoxification and withdrawal management. Polysubstance users often face severe withdrawal symptoms that require careful monitoring. The nurse should use the Clinical Institute Withdrawal Assessment (CIWA) scale or similar tools to assess withdrawal symptoms and ensure safety during detox. Tailored treatment plans. Treatment plans for polysubstance abuse must be individualized and address the specific risks and interactions of the substances involved. Relapse prevention. Ongoing counseling and support groups, such as 12-step programs, are critical to prevent relapse, and nurses should monitor for signs of relapse, which may be more frequent in polysubstance abusers. What is the role of environmental risk factors in addiction, and how should a nurse incorporate this knowledge when developing a treatment plan? Answer: environmental risk factors such as family history, peer influence, stressful life events, trauma, and socioeconomic conditions can significantly contribute to the development and perpetuation of substance use disorders. Understanding these factors is essential for tailoring treatment strategies. Family and peer influence. A nurse should inquire about the patient's family dynamics, social network, and any history of addiction within the family. Family therapy or support groups can be beneficial. Socioeconomic conditions. The nurse should assess whether financial stress, unemployment, or lack of access to healthcare is affecting the patient's ability to engage in treatment. Community resources and case management can be incorporated into the treatment plan. Trauma history. Many individuals with substance use disorders have experienced trauma, which can lead to self-medication with substances. Trauma-informed care ensures that the treatment respects the patient's history and uses interventions like trauma-focused therapy to address underlying issues. Stress management. Teaching stress reduction techniques such as mindfulness, meditation, or yoga can help mitigate environmental stressors and reduce the risk of relapse. Explain the relationship between stimulant use disorder, e.g., cocaine, methamphetamine, and mental health. What are the key treatment considerations? Answer: stimulant use disorders, such as those involving cocaine or methamphetamine, often co-occur mental health issues such as anxiety, depression, and paranoia. Stimulants can exacerbate existing mental health conditions or cause new psychological symptoms. Mental health impact. Stimulants increase dopamine levels, leading to temporary feelings of euphoria, but also significant neurochemical imbalances. Long-term use can lead to symptoms like agitation, psychosis, and memory loss, which complicate the mental health status of the individual. Treatment considerations. Integrated care approach. Treatment for stimulant use disorder must include counseling and behavioral interventions such as CBT to address both the addiction and the mental health symptoms. Pharmacological interventions. While there is no FDA-approved medication for stimulant use disorder, bupropion and modafinil have shown promise in managing cravings. Psychosocial support. Programs such as 12-step programs, motivational interviewing can help patients address both their addiction and mental health issues, improving long-term recovery outcomes. How can substance misuse of over-the-counter OTRA drugs, such as cough syrup, affect the treatment and assessment of addiction? Answer: the misuse of over-the-counter OTRA drugs, such as those containing dextromethorphan, found in many cough syrups, is often overlooked in addiction assessments because these substances are legally available. However, their misuse can lead to addiction, overdose, and psychological symptoms similar to illicit drugs. Assessment challenges. OTC drug misuse may be underreported because individuals may not recognize it as problematic. Nurses should ask targeted questions about any use of OTC medications, especially if the patient exhibits symptoms like confusion, agitation, or impaired motor coordination. Treatment considerations. Treatment for OTC drug misuse requires an individualized care plan that may involve detoxification, counseling, and substance-specific interventions. Nurses should also educate patients about the dangers of misusing OTC drugs and encourage responsible usage. Drug interaction. Nurses should be aware of potential drug interactions between OTC substances and prescribed medications, particularly those that may affect liver function or cause sedation. Why is it critical for addiction nurses to understand the long-term effects of alcohol and drug misuse on physical health, and how does this impact treatment planning? Answer: long-term alcohol and drug misuse can lead to a range of physical health problems, including liver damage, cardiovascular disease, neurological impairment, and respiratory issues. Understanding these effects is crucial for nurses when developing comprehensive care plans for patients with substance use disorders. Physical health impact. Chronic alcohol use can cause liver cirrhosis, pancreatitis, and cognitive decline. Long-term opioid use may result in respiratory depression and neurological damage. Stimulant abuse can lead to heart problems, stroke, and kidney damage. Impact on treatment planning. Nurses should monitor for physical complications related to substance abuse during the assessment and incorporate appropriate interventions such as medical detox, nutritional support, and management of chronic conditions, e.g., hypertension, liver disease. Multidisciplinary approach. Collaboration with physicians, nutritionists, and physical therapists ensures comprehensive care that addresses both the addiction and its long-term health effects. How can family dynamics influence the development and treatment of substance use disorders, and what strategies should a nurse employ when involving family members in treatment? Answer: family dynamics play a significant role in both the development and treatment of substance use disorders. Dysfunctional family environments, including codependency, enabling behaviors, and family trauma, can contribute to the onset and persistence of addiction. However, family involvement in treatment can provide a supportive framework for recovery. Family influence. Positive family support can encourage recovery, while toxic family dynamics may exacerbate addiction. Family members may enable substance use by providing financial support or minimizing the problem. Treatment strategies. Family counseling. Nurses should recommend family therapy to address dysfunctional family patterns and teach healthier ways of supporting the patient. This may include family education on addiction and boundary setting techniques. Involvement in recovery. Nurses should encourage family members to attend support groups like Al-Anon and Nar-Anon, where they can gain insights into addiction and learn how to support their loved ones' recovery without enabling harmful behaviors. What are the key neurochemical pathways involved in addiction, and how do they influence behavior and addiction development? Answer: the key neurochemical pathways involved in addiction primarily include the dopaminergic, glutamatergic, and GABAergic systems. These pathways play crucial roles in the brain's reward system, influencing reinforcement, pleasure, and habit formation. Dopaminergic pathway. The mesolimbic dopamine system, particularly the ventral tegmental area vitae and the nucleus accumbens, is central to the brain's reward system. Dopamine release in these areas enhances pleasure, reinforcing behaviors associated with substance use. Over time, substance use hijacks this pathway, leading to reward-seeking behavior and craving. Glutamatergic system. Glutamate, the main excitatory neurotransmitter in the brain, is involved in synaptic plasticity, which underlies learning and memory. In addiction, the long-term potentiation of glutamatergic signaling in reward-related brain circuits contributes to the formation of drug-associated memories, making it difficult for individuals to resist cravings. GABAergic system. Gamma-aminobutyric butyric acid. GABA is the primary inhibitory neurotransmitter. Chronic substance use, particularly alcohol or benzodiazepines, can reduce GABAergic inhibition, leading to neuroadaptation and the development of tolerance and dependence. Understanding these pathways is critical in developing pharmacological and behavioral interventions. For example, dopamine antagonists may be used to block the reinforcement of drug-taking behavior, while glutamate modulators like N-acetylcysteine (NAC) are explored for treating cravings in substance use disorders (SUDS). What are the stages of addiction development, and how does understanding these stages inform nursing interventions? Answer: the stages of addiction development are typically described as follows. Initial use occurs due to curiosity or social influence, leading to sporadic and occasional use of substances. Regular use. The individual uses the substance with increasing frequency and it begins to interfere with their daily life. At this stage, substance use is primarily voluntary, but psychological dependence starts to form. Risky use. The individual engages in substance use despite negative consequences, such as health problems or legal issues. Psychological dependence deepens and tolerance develops. Dependence. Characterized by physical and psychological dependence, the person needs the substance to function normally. Withdrawal symptoms are evident when not using. Addiction, the individual's life becomes controlled by the substance and there is a loss of control over use. Severe health, legal, and social consequences occur. Nursing interventions vary at each stage. For early stages, initial and regular use, nurses can focus on prevention and education on the risks of substance use. In the risky use and dependent stages, interventions should target behavioral therapy and psychosocial support to address underlying psychological issues. How does the biopsychosocial model of addiction differ from the disease model, and which model is more applicable for comprehensive nursing care in addiction recovery? Answer: the biopsychosocial model and the disease model are two key frameworks used to understand addiction. Biopsychosocial model. This model views addiction as a complex interplay of biological, psychological, and social factors. It emphasizes that addiction is not just a disease, but the result of genetic predispositions, psychological traits, e.g., trauma, mental health disorders, and social environment, e.g., peer pressure, family dynamics, psychological, pharmacological treatment, biological and social support systems. Disease model. This model conceptualizes addiction primarily as a chronic disease similar to conditions like diabetes or hypertension, often focusing on neurochemical changes in the brain as the cause of compulsive behavior. It views addiction as a medical condition that requires treatment, typically involving abstinence and maintenance therapy, e.g., methadone for opioid use disorder. For comprehensive addiction recovery nursing, the biopsychosocial model is more applicable because it recognizes the complexity of addiction and allows for a more individualized approach, addressing not just the disease but also the psychological and social challenges that contribute to substance use. Mr. Davis has been struggling with alcohol use disorder for the past 5 years. He has tried to quit several times but relapses after a few weeks. He is currently experiencing tremors, anxiety, and sweating after not drinking for 2 days. As his nurse, what steps should you take to assess and manage his withdrawal symptoms? Answer: Mr. Davis is exhibiting signs of alcohol withdrawal which can range from mild to severe and in some cases life-threatening, e.g. delirium tremens. The nursing approach involves assessing withdrawal severity, use of tools such as the Clinical Institute Withdrawal Assessment for Alcohol (CIWA) to evaluate the severity of his symptoms, monitoring for complications. Alcohol withdrawal can lead to seizures, delirium tremens, DTS, or cardiovascular complications. Nurses should closely monitor Mr. Davis for signs of these complications, which could require medical intervention, e.g. benzodiazepines for seizures. Pharmacological interventions. For moderate to severe withdrawal symptoms, benzodiazepines, e.g. lorazepam, are commonly prescribed to prevent seizures and reduce anxiety. These medications help manage symptoms of withdrawal and stabilize the patient. Supportive care. Ensure that Mr. Davis is hydrated, nourished, and comfortable. Assess his mental health and offer psychosocial support as needed. Planning for long-term recovery. As his symptoms stabilize, discuss behavioral therapies and the role of 12-step programs or other recovery-focused support systems to prevent future relapses. What is the role of the Certified Addictions Registered Nurse, CAN, in supporting clients through the recovery process, and how does this role differ from that of other healthcare professionals in addiction treatment? Answer: the Certified Addictions Registered Nurse, CAN, plays a unique and multifaceted role in addiction recovery. Key responsibilities include assessment and monitoring. Nurses assess the physical and mental health of clients, monitor for withdrawal symptoms, and manage any medical complications arising from addiction. They use standardized tools, e.g. CIWA, CAG questionnaire, to assess the severity of addiction and withdrawal. Medication administration. Nurses may be involved in administering medication-assisted treatments for addiction such as methadone, buprenorphine, or naltrexone for opioid use disorder, and ensuring the proper use of benzodiazepines or antidepressants to manage symptoms. Education. Nurses educate patients and families about the nature of addiction, recovery strategies, medication adherence, and relapse prevention. Collaborative care. Nurses collaborate with other healthcare providers, including psychologists, social workers, and physicians, to create a comprehensive, patient-centered recovery plan. The primary difference between a CARN and other healthcare providers, e.g. social workers, psychologists, lies in the nurse's emphasis on biological management, medical care, and monitoring, while therapists focus on psychosocial aspects of recovery. CARNs address the physical health of the patient, ensuring they are safe during withdrawal and treatment. How do tolerance, dependence, and withdrawal differ in the context of substance use disorders, and how should addiction nurses manage each of these phenomena in clinical practice? Answer: tolerance. Tolerance occurs when an individual needs an increasing amount of a substance to achieve the same effect. Over time, the brain's reward system becomes less responsive to the substance. Nursing intervention involves educating patients about the risks of increased dosage, especially in substances like opioids and benzodiazepines where overdose can occur. Dependence. Dependence refers to the physiological and psychological state in which the individual relies on the substance to feel normal. It often involves neurochemical adaptations that create cravings and compulsive use. Nurses should assess for signs of dependence and help patients with strategies to wean off substances safely, typically through tapering schedules. Withdrawal occurs when a dependent person stops using a substance, leading to symptoms such as anxiety, nausea, and tremors. The nursing approach includes monitoring withdrawal symptoms, administering medications to manage symptoms, e.g., benzodiazepines, and providing supportive care, e.g., hydration, comfort. What are the key principles of addiction recovery, and how do these principles guide nursing interventions in a recovery-oriented system of care? Answer: the key principles of addiction recovery include hope. Recovery is possible and individuals can overcome addiction. Nurses should provide support and encouragement to instill hope in patients. Personal responsibility. Individuals must take responsibility for their recovery journey. Nurses help patients set goals and work toward achieving them. Holistic approach. Recovery involves physical, emotional, and spiritual healing. Nurses use the biopsychosocial model to address all aspects of a patient's life. Peer support. Recovery is enhanced by social connections and community support. Nurses may refer patients to support groups like AA or NA. By focusing on these principles, addiction nurses can support patients in their journey toward long-term recovery. How can the social learning model of addiction provide insight into the behaviors of individuals with substance use disorders, and what interventions can addiction nurses apply based on this model? Answer: the social learning model posits that addiction is learned through observational learning, reinforcement, and role modeling within the individual's environment. Factors like peer influence, family dynamics, and media portrayals of substance use can contribute to the development of addictive behaviors. Based on this model, addiction nurses can intervene by encouraging positive role models and peer support groups that reinforce healthy behaviors, helping patients identify triggers and learning maladaptive coping strategies in favor of healthier coping mechanisms. Family therapy involving families in treatment can help disrupt unhealthy patterns and promote positive reinforcement in recovery. By understanding the social learning model, nurses can create more targeted interventions that address the environmental factors contributing to addiction. How does trauma-informed care impact addiction nursing practice, and what specific strategies can addiction nurses employ to integrate this approach into their patient care? Answer: trauma-informed care (TIC) acknowledges the widespread impact of trauma and the need for sensitive treatment that avoids re-traumatization. Addiction nurses must understand that many individuals with substance use disorders (SUDS) have a history of adverse childhood experiences, ACEs, or other forms of trauma which can significantly impact their recovery. Specific strategies include creating a safe and supportive environment, ensure that patients feel physically and emotionally safe, building trust and transparency, establishing trust through consistent communication and clear boundaries, empathetic listening, actively listening to patients' experiences without judgment, avoiding coercion, providing autonomy and avoiding authoritative or punitive approaches, collaboration, involving patients in decision-making processes regarding their care. Integrating TIC into addiction nursing helps to create a holistic approach that addresses both the addiction and the trauma underlying it, promoting recovery. How do medication-assisted treatments map for opioid use disorder work, and what considerations must addiction nurses keep in mind when administering these medications? Answer: medication-assisted treatment MAP for opioid use disorder combines pharmacological treatments with behavioral therapy to treat opioid addiction. Common medications include methadone, a long-acting opioid agonist that reduces cravings and withdrawal symptoms, buprenorphine, a partial opioid agonist that also alleviates cravings while minimizing the effects of misuse, naltrexone, an opioid antagonist that blocks the effects of opioids and reduces cravings. Addiction nurses should consider the following: dosing and monitoring. Ensure correct dosing and monitor for signs of overdose, especially during induction phases. Side effects: be aware of respiratory depression, sedation, and QT interval prolongation, and intervene when necessary. Patient education: provide education on the importance of adherence to MAT and discourage abstinence-based thinking that may lead to relapse. Multidisciplinary collaboration: work closely with pharmacists, therapists, and other team members to ensure an integrated approach. What is the role of buprenorphine in the treatment of opioid use disorder, and how does it differ from methadone in terms of its mechanism of action and safety profile? Answer: buprenorphine is a partial agonist at the opioid receptor, specifically the mu-opioid receptor, and it is used in the treatment of opioid use disorder. Unlike full agonists like methadone, buprenorphine has a ceiling effect, meaning its effects plateau after a certain dose, reducing the risk of overdose. It works by alleviating withdrawal symptoms and cravings without producing the same level of euphoria associated with full agonists like heroin or oxycodone. Methadone, on the other hand, is a full agonist that activates opioid receptors more completely. This increases the risk of overdose, especially if not properly monitored. Both buprenorphine and methadone are used as part of medication-assisted treatment (MAT), but differ in their safety profiles and potential for abuse. Relevant guidelines rules. The Substance Abuse and Mental Health Services Administration (SAMHSA) and the National Institute on Drug Abuse (NIDA) provide guidelines for the use of these medications. Buprenorphine is typically preferred for outpatient settings due to its low risk of overdose, while methadone is generally used in a supervised setting. In what ways does cognitive behavioral therapy (CBT) address the psychological aspects of addiction, and how does it compare to motivational interviewing in terms of treatment focus and application? Answer: cognitive behavioral therapy (CBT) is a therapeutic approach used to help individuals recognize and change maladaptive thought patterns and behaviors associated with addiction. It operates on the premise that thoughts influence behavior, and by changing irrational or harmful thoughts, individuals can alter their behaviors. CBT addresses issues like cognitive distortions, e.g., like and never quit using drugs, and helps individuals develop coping skills for managing triggers and stress. Motivational interviewing, on the other hand, focuses more on enhancing an individual's intrinsic motivation to change. MI is client-centered and non-confrontational, with a focus on resolving their ambivalence and increasing the desire to change behaviors. While CBT is more structured and focused on skill building, MI is more flexible, aiming to evoke motivation for change, especially in the early stages of treatment. Relevant guidelines rules. MI is often employed in early treatment stages to engage clients who may not yet be ready for more structured interventions like CBT. The American Society of Addiction Medicine, the SAM, guidelines advocate for the use of MI in combination with other therapies like CBT for effective treatment. Mr. Thompson has been diagnosed with opioid use disorder and has recently started treatment with methadone. He has been stable for several weeks, but he is now presenting with symptoms of drowsiness and confusion. What should the nurse do in response to these symptoms? Answer: Mr. Thompson's symptoms of drowsiness and confusion may indicate a potential overdose or adverse reaction to the methadone treatment. As methadone is a full agonist at opioid receptors, it can cause respiratory depression, especially if taken with other central nervous system depressants or at higher than prescribed doses. The nurse should immediately assess Mr. Thompson's respiratory rate, oxygen saturation levels, and level of consciousness. If signs of overdose are present, e.g., slow, shallow breathing, altered mental status, naloxone, Narcan should be administered as an opioid antagonist to reverse the effects of methadone. Additionally, the nurse should review the dosage and any other medications Mr. Thompson is taking, as interactions with other CNS depressants, such as benzodiazepines or alcohol, may have contributed to these symptoms. Continuous monitoring and communication with the prescribing physician are essential for adjusting the methadone dose appropriately. The relevant guidelines rules. SAMHSA recommends that methadone be administered in a supervised setting with close monitoring, especially during dose initiation or adjustment. What is the significance of trauma-informed care (TIC) in addiction treatment, and how does it impact the overall approach to client care? Answer: trauma-informed care (TIC) recognizes the widespread impact of trauma on individuals and integrates this understanding into the treatment process. People with addiction often have a history of trauma, such as physical or emotional abuse, neglect, or adverse childhood experiences. ACEs. TIC aims to create a safe environment where individuals feel physically and emotionally safe and are empowered to make decisions about their care. TIC principles include ensuring trustworthiness, choice, collaboration, and empowerment throughout the treatment process. The goal is not only to treat the addiction, but also to address the root causes of trauma and support recovery by promoting healing and resilience. This approach contrasts with traditional addiction treatment methods that may not account for the psychological effects of trauma. For example, if a client presents with resistance to treatment or avoidance behaviors, TIC allows the provider to explore potential trauma history and adjust treatment strategies accordingly. How does the use of disulfiram as a deterrent in alcohol treatment work, and what are the potential risks and side effects of this medication? Answer: disulfiram antibase is used as a medication to help prevent relapse in individuals with alcohol use disorder. It works by inhibiting the enzyme aldehyde dehydrogenase, which is responsible for metabolizing acetaldehyde, a byproduct of alcohol metabolism. When alcohol is consumed while taking disulfiram, acetaldehyde builds up in the body, leading to unpleasant symptoms such as nausea, vomiting, flushing, and headache. These effects serve as a deterrent to alcohol consumption. While disulfiram can be effective in encouraging abstinence, it carries several risks, particularly if the patient consumes alcohol during treatment. Serious reactions can include cardiovascular complications, respiratory distress, and in severe cases, liver damage. Relevant guidelines rules. According to the American Society of Addiction Medicine, some disulfiram should be prescribed only after the thorough evaluation of the patient's readiness for sobriety and understanding of the potential risks. Nurses must closely monitor liver function and educate patients on the dangers of consuming alcohol while on disulfiram. What is the primary difference between individual therapy and group therapy in addiction treatment, and what factors should influence the choice of therapy modality for a patient? Answer: individual therapy in addiction treatment is a one-on-one approach between the therapist and the patient, focused on personal issues, triggers, and the development of individualized coping strategies. This modality allows for a more tailored treatment plan, offering privacy and a more focused approach to resolving personal challenges. Group therapy, on the other hand, involves multiple patients meeting together to share experiences and provide mutual support under the guidance of a trained therapist. Group therapy fosters a sense of community and reduces feelings of isolation, allowing individuals to learn from others' experiences and gain social support. The choice between individual and group therapy depends on several factors, including the patient's preference, the severity of the addiction, co-occurring mental health disorders, and readiness for group participation. For example, patients with severe trauma or social anxiety may benefit from individual therapy first, while those seeking community support may thrive in group settings. What are the risks associated with long-term use of naltrexone in the treatment of opioid use disorder, and how can these risks be mitigated? Answer: naltrexone is an opioid antagonist used in the treatment of opioid use disorder. It works by blocking opioid receptors, preventing the euphoric effects of opioids and thus reducing cravings. However, long-term use of naltrexone can present certain risks. One of the primary risks is the potential for overdose if the patient relapses while taking naltrexone. Because naltrexone blocks opioid effects, individuals who attempt to overcome the block by using opioids may experience a delayed or heightened overdose risk once naltrexone's effects wear off. Additionally, naltrexone can cause liver toxicity in rare cases, necessitating regular monitoring of liver function. Other side effects may include gastrointestinal distress, headaches, and insomnia. Relevant guidelines rules. The FDA requires liver function tests before starting naltrexone and periodically during treatment. AMHSA provides specific guidelines for monitoring patients on naltrexone, including the use of supportive care for patients who may be at risk of opioid overdose after discontinuing the medication. What is the purpose of contingency management in addiction treatment, and how is it applied effectively in a clinical setting? Answer: contingency management. Centimeters is an evidence-based therapeutic technique used to reinforce positive behavior change in addiction treatment by providing tangible rewards for achieving specific treatment goals, such as drug-free urine tests. The core principle of CM is to provide immediate reinforcement for abstinence or other desired behaviors, which helps motivate individuals to continue treatment and make progress in their recovery. In clinical settings, CM can be applied through a voucher system where patients earn vouchers for positive behavior, negative drug tests, which they can exchange for rewards. The effectiveness of CM is well documented in the treatment of stimulant use disorders, but it has been applied to other types of addiction as well. Relevant guidelines rules. SAMHSA endorses CM as part of a comprehensive treatment plan, particularly for individuals with stimulant use disorders. CM must be integrated with other treatment modalities, such as counseling and support services, to ensure long-term recovery. Mrs. Lee has been undergoing treatment for alcohol use disorder and has been participating in both individual therapy and group therapy for several months. However, she is now expressing feelings of frustration and discouragement, stating that she feels the therapy is not helping. How should the treatment team address her concerns? Answer: Mrs. Lee's frustration may be indicative of a number of underlying issues such as ambivalence about recovery, unrealistic expectations, or unmet needs in the treatment process. The treatment team should first conduct a thorough assessment of her concerns and provide a supportive environment where Mrs. Lee feels heard and validated. It may be necessary to explore her goals for treatment and determine if the current therapy modalities are meeting her needs. The team might recommend adjusting her treatment plan, possibly by enhancing her involvement in group therapy, integrating a more trauma-informed approach, or adjusting therapeutic techniques, e.g. introducing CBT if it hasn't been used. Relevant guidelines rules. ASAM guidelines recommend a flexible and responsive approach to treatment, adjusting plans as needed to ensure the patient's engagement and progress. It is crucial to address any underlying emotional or psychological factors contributing to a discouragement and adjust the treatment plan accordingly. What are the key considerations when prescribing SRIs, selective serotonin reuptake inhibitors, for patients with co-occurring depression and substance use disorder? Answer: Selective serotonin reuptake inhibitors (SRIs) are commonly prescribed to treat co-occurring depression in patients with substance use disorder. They work by increasing serotonin levels in the brain, improving mood, and alleviating symptoms of depression. However, there are key considerations when prescribing SSRIs to individuals with SUD. SSRIs can interact with certain substances, including alcohol and illicit drugs, which may either reduce their effectiveness or exacerbate side effects. Additionally, individuals with a history of substance abuse may have a higher risk of misuse or non-adherence to SSRIs due to the potential for feeling numb or disconnected from emotions. The prescribing clinician should carefully monitor for any signs of worsening depression or suicidal ideation, particularly in the early stages of treatment. Regular follow-up is essential. Relevant guidelines rules. AMHSA guidelines on co-occurring disorders recommend that SSRIs be used as part of a comprehensive treatment plan, including counseling and therapy. Close monitoring for side effects, adherence, and potential drug interactions is crucial.